Let's talk about removing nasal silicone implants. When people get nose surgery, silicone implants are often used to raise the bridge of the nose. Today I'll go over 3 reasons why people choose to have these silicone implants removed. First, the most common reason is when there are side effects. For example, if there's inflammation or infection, especially if it's progressing into contracture, you really don't have a choice in these cases. You absolutely have to get it removed. Especially if contracture is causing the tip of your nose to lift up, it's best to have the implant removed as soon as your schedule allows, even a day sooner if possible. Next, even if it hasn't progressed to contracture, if there's an acute infection, you need to remove the silicone quickly and perform irrigation. And with an infection that severe, even if contracture isn't present at the time, it can develop later on. So in these cases, removal is necessary. Next, the second case is when there is some cosmetic dissatisfaction or the shape doesn't look good. There can be various reasons for this. For example, if the skin is thin but you try to make it too high, or if the skin was just too thin from the start, so even a slight augmentation makes the silicone too visible, these kinds of issues can occur. Another example is when the silicone is too bent, so people often say that your nose looks crooked. A crooked nose, and although it's rare, silicone calcification, especially in people who used ELSA silicone in the past, can also occur. In such cases, it would look a bit unnatural cosmetically. Since we're talking about ELSA silicone, in some people, the ELSA silicone is inserted all the way to the tip of the nose, so sometimes the silicone can be visible at the tip. In that case, it really looks unnatural and is not good cosmetically, so in such situations, the silicone may need to be removed as well. Lastly, the third case is when, somewhat non-specifically, some people just feel discomfort or psychological unease or anxiety. Whether this necessarily becomes a reason for removal is a bit ambiguous. Because just because you feel psychologically uneasy, it doesn't necessarily mean you have to remove it. There are people who feel so anxious and distressed that it seriously affects their daily life. And then, there are also people who feel a tightening sensation in their nose or experience tenderness in this area. Honestly, I don't think these issues can be ignored either. Some people just feel uncomfortable about having silicone in their nose simply because it's a foreign object. In such cases, insisting that it's fine, no matter what, can actually lower the patient's quality of life. So removal can be considered in those situations as well.
So if you remove the silicone from the nose, does it go back to how it looked before the surgery?
That's actually a question a lot of patients ask, and it's also a really difficult issue. If, for example, the patient only had a silicone implant placed in the bridge of the nose and nothing else, then it is possible for the nose to return to how it was before. But even in this case, I can't guarantee it 100%. Because if the silicone has been in place for a long time, the skin can stretch a bit and the area where the silicone was can get slightly compressed. However, in most cases, people also build a column at the tip of the nose or add some cartilage or something like that. So even if you remove the silicone, the shape of the tip of your nose might be a bit different from before, because the shape of the tip has changed.
There are also people who say that even after removing the silicone, their nose feels hard or doesn't move well.
If your nose still feels hard even after removing the silicone, it's usually because the tip of the nose was previously reinforced with a strong support or pillar. That's probably the case most of the time. It's important to make a proper distinction. If you feel there's something wrong with your nose and it's because the tip feels hard and uncomfortable, sometimes just softening the tip of the nose without removing the silicone can solve the problem. So in these cases, it's important to make that distinction carefully. Finding the cause of the hardness and addressing it is a good solution. Depending on these various cases, silicone may end up being removed. Today, I talked about the reasons behind that. If time permits, I will later talk about methods of removal and then how reconstruction is done after removal and so on.